Your eyes are dry, scratchy, and maybe even burning. It feels like there's sand in them and blinking doesn't help. Does this sound familiar? Let's fix it. I'm an optometrist and I'm here to give you exactly what you need to do to fix your dry eyes with no fluff, just pure solutions. Let's get into it. All right, the first thing you need to do is do artificial teardrops. And I know you've probably already tried this and every single doctor you go to tells you to do that. But there are better ones than others. First thing you need to know is don't use Visine. Visine makes your eyes actually more dry, so avoid that brand. Also, with artificial teardrops, things you want to use are Refresh, Sustain, and TheraTears, but use the ones that say PF or preservative free on the actual box. Those are the better artificial teardrops, and use these 2 to 4 times a day or as needed throughout the day. The other thing you can do is simply use a warm compress and have good lid hygiene. If your eyes feel dry and gritty, your oil glands might be clogged. Try a warm compress, meaning hold a warm washcloth over your eyes for 5 to 10 minutes twice a day. You can also use what is called a Bruder mask, Bruder, or some other type of sty mask. These masks you throw in a microwave, you put them on your eyes, the heat lasts longer and can penetrate the oil glands a lot more efficiently. Follow that up with some good lid wipes and have good lid hygiene. Sometimes we have some crusting around the eyelids. It just needs to go away. Otherwise, your dry eyes will become more severe. And a good brand of lid wipes are called OcuSoft. The next thing you can do is just blink more. I know it sounds silly, but staring at a screen or your tablet or your phone actually causes your eyes to be more dry because you blink less, and this has been scientifically proven. A good rule to follow is called the 20-20-20 rule. All this means every 20 minutes, you look away 20 feet away from your device for 20 seconds and just remind yourself to blink. Set a timer to do this. This keeps your tear film healthy and overall reduces your dry eyes, and it's a good, easy method to do. The next easy thing you can do is to simply add omega-3 supplements. Adding omega-3 fatty acids like fish oil or flaxseed oil to your diet can help reduce inflammation and improve your tear quality. Try 1,000 to 2,000 milligrams daily and just make sure it's a high quality supplement. Your eyes will thank you. All right, the next easy thing you can do is simply just stay hydrated and just adjust your environment. Drink more water. Dry eyes can be worse if you're dehydrated. Makes sense, right? Think about it. Also, if you're in a dry or air conditioned area, use a humidifier to add moisture to the air. And if you drive a lot, aim those air vents away from your face. Your eyes aren't meant to be in a wind tunnel. All right. Another thing you can do is just avoid rubbing your eyes. I know it's tempting, but rubbing your eyes makes dryness worse by irritating the surface and messing up your tear film. Instead, just use eye drops, the ones we mentioned before, preservative-free artificial teardrops, or use a cold compress if your eyes feel irritated. Your future self will thank you. Let's talk about some advanced treatments. If none of this, what I mentioned before, is working, it might be time to bring out the big guns. No pun intended. Here are 5 advanced treatments for severe dry eyes. First, we have LipiFlow, and this is a spa treatment for your eyelids. It gently heats and massages your oil glands to unclog them, helping your tears stay on your eyes longer. Number 2 is Intense Pulse Light Therapy, also known as IPL. Originally used for skin treatments, IPL can help reduce inflammation around your eyes and stimulates better oil production. If your dry eyes are from meibomian gland dysfunction, IPL could be a game changer for you. All right, the third advanced treatment is autologous serum eye drops. These are eye drops made from your own blood serum. They contain growth factors and healing proteins that help repair severe dry eye damage. These are often prescribed for chronic or autoimmune related dry eyes. Fourth thing you can do is scleral contact lenses. If your eyes are severely dry and sensitive, scleral lenses trap a layer of moisture over your cornea, giving you constant relief. These are especially helpful for people with Sjogren's syndrome or severe MGD. All right, the fifth advanced treatment you can do is amniotic membrane therapy. If your cornea is severely damaged, amniotic membrane grafts like Procara can help regenerate and heal the surface. These are used for advanced cases where nothing else is working. All of these require a visit to an eye doctor, but if you have chronic dry eye that won't go away, these are definitely worth looking into. Now we're at the part of the video where you need to do this. So make sure you do that. All right, another thing you can do is just use prescription treatments. If over-the-counter treatments aren't enough, talk to your eye doctor about prescriptions like Restasis, Xiidra. These drops can help your body produce more natural tears instead of just adding artificial moisture. They're a great option if your dry eyes is caused by inflammation. And another thing you can talk to your doctor about is the possibility of using steroids to help control a lot of the inflammation. So then you can maybe try some more homeotherapeutic things that we mentioned before just to get some of the inflammation under control. So here are my final thoughts, and here's your dry eye survival plan. Use artificial teardrops, ones that are preservative-free, no Visine, warm compress and lid hygiene, blink more, omega-3 supplements, hydrate and adjust your environment, stop rubbing your eyes, and consider some advanced treatments like IPL, LipiFlow, and then maybe some other medications that are designated for dry eyes. Simple, right? Now go fix your dry eyes and go drink some more water. I know your mouth is really dry right now, and you probably haven't even blinked since you started watching this video. If this helped, like and subscribe, and drop a comment if you have any questions. Stay hydrated, and I'll see you at the next video.